a quick public service announcement. I would like to remind everybody about a machine called Ulthera. It's got some benefits and people use it for the jawline and neck without any issues typically, but when it's done in the face, it can deflate the face. And if it's done once, not a big deal. If it's done twice, not a big deal. After that, I think any improvement would be purely imaginative on the person who's doing it, thinking that they're really tightening the skin or doing anything like that. They're actually kind of starting to scar the tissues at that point. And although we would wish or hope that these SMAS or the deeper layers would shrink concentrically, they typically don't. They just deflate and shrink in that direction, which is not so great. So I say that because I don't think Ulthera should be used as a maintenance treatment where you do it once a year. It's good to do once, maybe twice, and that's it. And I see this a lot because I get so many consults. Tons and tons of consults with people confused as to why they're looking older, why these shadows are forming on their face. And they show me photos from a couple of years ago, and it is no coincidence that they've had Ulthera 3 times and that their face started to age more rapidly. It accelerated the aging process in a lot of people. So I think it's a nice treatment for the jawline and neck because it's okay if you lose some fat there or shrink any of the deeper tissues, but in the face, I don't think it does anybody any favors, especially when done as maintenance. It's not a vitamin, it's not a healthy treatment. Everything that we do that's heat-based, these are damaging treatments, and we're lucky that the body recuperates from them. We have to remember that every time we do one.